Welcome back, my good people, and in today's video we are going to talk about pneumonia. We are going to look into details, definition of pneumonia, clinical presentation of pneumonia, that is signs and symptoms. We are going to expound into details, causes of pneumonia, risk factors pegged on pneumonia, how can we diagnose pneumonia in terms of laboratory investigations and imaging. Then we are also going to branch into management of pneumonia, and finally we are going to tackle about prevention of pneumonia. If you have not subscribed to this channel, kindly click the notification bell written subscribe, turn it on for more videos that I will post. And also my returning subscribers, hey, thank you so much for coming back and clicking this video. Now let's jump into the video and enjoy it until the end. Pneumonia, causes, symptoms, diagnosis and management. Welcome again, and let's do it. By definition, pneumonia is an infection that inflames the air sac in one or both lungs. Pneumonia is an inflammatory condition of the lung, primarily affecting the small air sacs known as an alveoli. So we can just say that it is an inflammation of lung parenchyma. The term pneumonia is sometimes more broadly applied to any condition resulting in inflammation of the lungs caused, for example, by autoimmune disease, chemical burns, or drug reaction. However, this inflammation is more accurately referred to as pneumonitis. Now, this is how the patient will present, and systematically there will be high fever and chill. There's some clumsiness and blueness on the skin. On the lung part, there can be cough with sputum or phlegm, shortness of breath, chest pain, or hemoptysis. In muscular, the patient might be fatigued and have aches. Central nervous system, there might be headache, loss of appetite, sometimes mood swing, low blood pressure in cardiovascular system, and even high heart rate. There might be some nausea and vomiting, and even joint pains. Now, we classify pneumonia into two based on how the infection is acquired. Number one, we have community acquired pneumonia, that is CAP, and it is the most common type of pneumonia. Number two, we have nosocomial pneumonia, that is hospital acquired pneumonia, HAP. Ventilator associated pneumonia, those are people who normally acquire pneumonia where they are in ICU and they are using mechanical ventilators. Healthcare associated pneumonia. Now, there are factors that may worsen or predispose you to pneumonia even before we talk about causes. Like if you are a smoker and your immune system is down, for example, those who have HIV, AIDS, or even cancers. If you are a chronic taker of alcohol, or you have problems with your lung called chronic obstructive pulmonary disease. Sicklers are not left behind, or even those who normally suffer from asthma. Chronic kidney disease is also one of them, together with liver disease. Biological aging, this one affects the geriatrics, that's the old men and women. Additional risk in children include not being breastfed. Exposure to cigarette smoke, air pollution is also one of them. Malnutrition plays an important role in this. Poverty is also there. The use of acid suppressing medications such as proton pump inhibitors like clonazepam and omeprazole also play a role here. Even H2 blockers like cimetidine, ranitidine is associated with an increased risk of pneumonia. Approximately 10% of people who require mechanical ventilation develop ventilator-associated pneumonia, as I've mentioned earlier. People with gastric feeding tube have an increased risk of developing aspiration pneumonia. Moreover, the misplacement of feeding tube can lead to aspiration pneumonia. That is about 28% of the tube malposition results into pneumonia. So this one we must take very, very serious when somebody has severe anemia and also needs feeding. Sometimes now we just consider parenteral more than feeding tube, because of this 28% of tube malposition can result into pneumonia, even if you insert NG tube in a very, very proper manner. Now, causes of pneumonia is due to an infection caused primarily by bacteria. In fact, bacteria play an important role here. There are also viruses, and less commonly by fungi or even parasites. Mixed infections with both viruses and bacteria may occur in roughly 45% of infection in children and 15% infection in adults. So you must be able to know that in children, pneumonia is very, very virulent in terms of infection. We should be able to know that factors that predisposes you to pneumonia, as we've mentioned. Now, bacteria are here, and you may forgive me because these are medical terms. Streptococcus pneumoniae play a very important role in 50% causes of pneumonia, followed by Haemophilus influenza and Chlamydophila pneumoniae. Staphylococcus aureus, group A, Streptococcus, Klebsiella pneumoniae, Moxirella catarrhalis, Mycoplasma pneumoniae, Legionella pneumoniae, Pseudomonas aeruginosa. Now, bacteria are the most common cause of community acquired pneumonia, and methicillin-resistant Staphylococcus aureus, that is MRSA, Escherichia coli, and other Enterobacteriae are the predominant causes of HAP, VAP, and HCAP, as I've mentioned in the previous slide. Now, viruses also play an important role here, and we say that viruses account for about 1/3 of pneumonia cases, and in children for about 15% of them. Commonly implicated agents include rhinoviruses, coronaviruses, you've known corona now, influenza viruses, respiratory syncytial viruses, RSV, adenoviruses, parainfluenza viruses, herpes simplex viruses, and even CMV cytomegalovirus. Severe acute respiratory syndrome, that is coronavirus 2, SARS-CoV-2, this is what really disturbed the whole world, result in pneumonia. And when it was so virulent in the beginning, people were really dying every day, but we thank God for the vaccines. Fungi or fungal pneumonia. The fungal pneumonia is uncommon but occurs more commonly in individuals with weakened immune system due to AIDS, that is HIV, AIDS, immunosuppressive drugs, or other medical problem. Maybe it can be due to hypertension, maybe due to heart diseases, even chronic diseases like sickle cell can play an important role here. It is most often caused by Histoplasma capsulatum, Blastomyces, Cryptococcus neoformans, and this is also a #1 cause of one type of meningitis. We call it cryptococcal meningitis. Pneumocystic girovecin pneumonia, or what we call the PCP, is also very common in the hospital settings. Coccidioides immitis is also one of them. Parasites, there are variety that can affect, including Toxoplasma gondii, and this is very serious, normally affect the central nervous system and even can result into convulsion and even paralysis. Strongyloides tecuralis, Ascaris lumbricoids. Remember, worms, Ascaris lumbricoids, this is a round worm, can even cause pneumonia. Plasmodium malariae, malaria is also playing a very important here, and we will see the reason why Ascaris lumbricoids, Plasmodium malariae, Strongyloides tecuralis, and Toxoplasma gondii normally play important role here. So we say that this organism typically enter the body through direct contact with the skin, ingestion, or via an insect vector. Except for Paragominas westermani, most parasites do not specifically affect the lung but involve the lungs secondarily to other sites. Some parasites, in particular those belonging to the Ascaris and Strongyloides genera, stimulate a strong eosinophilic reaction which may result into eosinophilic pneumonia. In other infections such as malaria, lung involvement is due primarily to cytokine-induced systemic inflammation. In the developed world, these infections are most common in people returning from travel or immigrants. Around the world, parasitic pneumonia is most common in the immunodeficient, as we've seen. Non-infectious, that is idiopathic interstitial pneumonia. non-infectious pneumonia is a class of diffuse lung disease. They include diffuse alveolar damage, organizing pneumonia, non-specific interstitial pneumonia, lymphocytic interstitial pneumonia, desquamative interstitial pneumonia, respiratory bronchiolitis, interstitial lung disease, interstitial pneumonia. Lipoid pneumonia is one rare cause due to lipids entering the lung. This lipid can either be inhaled or spread to the lungs from elsewhere in the body. So you see, pneumonia is very, very serious. Now, when we want to diagnose our children, history and physical exam is very, very key in both adult and children. And again, in children, we may consider the history of cough or difficulty in breathing when a child is age 60 days old. So we look at the danger signs. That one, pulse oximetry, that is oxygen saturation of less than 90%. When there is central cyanosis, that is bluish coloration, maybe on the lips, around the tongue. Inability to drink if the child cannot drink or even be speed. Alertness to voice or pain or even unconscious. That is to voice, pain or unconscious. And when the child is grunting. And we also consider wheeze. If there is no wheeze, then we term it severe pneumonia, and this child should be admitted in the hospital or referred if you are in peripheries. Of course, we'll start expengenta, and oxygen should be there, and even supportive care like prevention of fever. When there's lower chest in drawing, this is what normally children normally come with, and even fast breathing. So we normally consider respiratory rate. If it is greater than 50, age 2 to 11 months, and pulse rate also greater than 14, age of 12 to 59 months, then it's just a simple pneumonia, or we go non-severe pneumonia. So we normally administer high dose of amoxicillin, around 40 to 45 milligrams, 12 hourly. And all those, if you see that a child has just a cough or cold, this is no pneumonia, we can just reassure the child, the mother, and we do the counseling. Now, physical examination may sometimes reveal low blood pressure, high heart rate, low oxygen saturation. The respiratory rate may be faster than normal, and this may occur a day or two before the signs. Examination of the chest may be normal, but it may show decreased expansion on the affected side. Harsh breath sounds from larger airways that are transmitted through the inflamed lung are termed as bronchial breathing and are heard on auscultation with a stethoscope. That now is our part. Crackles may be heard over the affected area during inspiration, that when we use stethoscope. When we percuss, it may be dull over the affected lung and increased rather than decreased vocal resonance, distinguishes pneumonia from pleural effusion. You know, pleural effusion, we have the stony dullness. Now, laboratory investigation, blood test, we may carry this, including blood culture, complete blood count, that is full hemoglobin polymerase chain reaction when we are looking for a specific organism. X-ray is very, very important, and we will be able to see some of them. Oxygen concentration, we will use pulse oximetry to determine that. We may also take your sputum and analyze, and this one we are doing it to rule out TB by doing gene expert. CT scan is also very, very important, and it will obtain a more detailed image of the lung. When you have pleural effusion, we can take the pleural fluid for culture and sensitivity so that we can determine which drug to give you. Now, these are examples of positive chest radiograph from indication of chest pain. As you can see, the first one is pneumothorax, that can result from pneumonia, even perihilar inflammation. This is a patient who has been very, very sick for a long time. Now, you can see that red arrow. What does it depict? Now, this is a question to medics. Okay. We should be able to know that this is a right mid-lobe pneumonia in a child as seen on plain X-ray. Now, to the medics, what can you see in that black arrow? So this is a chest radiograph of a 88-year-old man, about 1 week after onset of fever, fatigue, and mild coughing. Laboratory test detected both influenza A virus and Haemophilus influenza. It shows multifocal patchy consolidation mainly in the right upper lobe. So this is for us medics. You can see that patchy consolidation. What about this? What can you see? This one I've marked. Check the left or check the right. What can you see in this x-ray? Now let's go. This is also a chest radiograph showing a very prominent wedge-shaped air space consolidation in the right lung, characteristic of acute bacterial lobar pneumonia. And this one, clinical officers, nurses, and doctors must not fail to identify. Now, prevention is very, very important in pneumonia, and you get the vaccines. We are going to see that. You get the influenza shot. You practice good hygiene and refrain from smoking, and making healthy lifestyle choices. And this can range from one, diet, exercise frequently, and getting enough sleep. Make the right choice in order to enrich the strength of your immune system. Now, child welfare clinic in prevention. This is very, very important because there are target organisms we are looking at. We have pneumococcal conjugate vaccine that is given at 6 weeks, 10 weeks, and 14 weeks. It's very, very important to prevent pneumonia in children. And also the diseases that may cause pneumonia, as we've seen, Haemophilus influenza is one of the causes, and it is given as a vaccine that is pentavalent. Penta means 5. There are five diseases that we target. That is diphtheria, pertussis, tetanus, hepatitis B, Haemophilus influenza type B. So in this video we are targeting Haemophilus influenza, and the dose is given at 6, 10, and 14 weeks. So remember that your child is very, very important to you. You must bring your child for pneumonia and pentavalent vaccines as indicated. Management is normally case by case, and it will be on how the patient is presenting. Antibiotic by mouth, resting, simple analgesic, and fluid usually suffice to complete resolution. However, those with other medication condition, the elderly, or those with significant trouble breathing may require more advanced care. If the symptoms worsen, the pneumonia does not improve with home treatment, or complication occur, hospitalization may be required. Worldwide, approximately 7 to 13 cases of children are being hospitalized due to this. Now, pneumonia can cause severe illness in a number of ways. A pneumonia with evidence of organ dysfunction may require intensive care unit admission for observation and specific treatment. The main impact is on respiratory and circulatory system. Respiratory failure not responding to normal oxygen therapy may require heated humidified high flow therapy delivered through nasal cannulae, and I told you these are case by case. Antibiotics are very, very many and very, very different classes. Cephalosporin, carbapenems, fluoroquinolones, aminoglycoside, macrolide, aminopenicillin, and tetracycline may play a very, very important role in treatment of this. Even additional of corticosteroids, that's prednisolone, to standard antibiotic treatment appear to improve outcome, reducing death and morbidity for adults with severe community-acquired pneumonia, and reducing death for adult and children with non-severe community-acquired pneumonia. Please, pleural effusion, emphysema, and abscess are managed case by case. So, thank you so much. And if you feel that you are a student, click the video that's on how to take a history on pediatrics patient. See you in the next video.